Hello, everyone. My name is Gregory Gale. I am the Director of Recruitment and Admissions at the College of Psychology at Nova Southeastern University. And welcome to a very important and special discussion. Before we start, I have two announcements to make. First, this session is being recorded and will be available next week on nova.edu/sharkchats. The second thing I'd like to say is that please use the chat feature to submit your questions. So this very special discussion is titled Smoking, Vaping, and COVID-19, a Dangerous Mix. We'll be discussing the relationship between smoking, vaping, and COVID, as well as providing tips to successfully quit using tobacco products. Our presenter is Dr. Linda Carter Sobell. She is the President's Distinguished Professor of Excellence at Nova Southeastern University. She's nationally and internationally known for her research in the addictions field. She's a fellow in 7 divisions of the American Psychological Association and is board certified in behavioral and cognitive psychology of the American Board of Professional Psychology. She's presented over 200 invited talks. She's an expert motivational interviewing trainer and has presented over 175 motivational interviewing workshops. She's published over 300 articles and book chapters and 8 books and serves on 7 peer-reviewed editorial boards. She's the past president of the American Behavioral and Cognitive and Therapies, and past president of 2 APA divisions, 12, the Society of Clinical Psychology, and Division 10, Society of Addiction Society. So with that said, it's my pleasure to introduce you to Dr. Linda Sobell. Dr. Sobell.
Thank you very much, Gregory. Welcome all of you today. It is a strange time, obviously, for all of us. I hope everyone is doing well and stays safe. I thank Nova for allowing us to get our message out. Obviously, this is something very new related to the COVID-19 and extremely important because we've gone down from 65% smokers in the last 20-25 years. We have increased on things like vaping and so forth, but because it's such a big population, it is actually affecting people out there in the community more than they would think and impacting them negatively. And not a lot of people know this. So I think it's a good time to kind of just share what we're talking about. I'm going to give some reason for it. One of the things I do is I'm a clinical scientist, so you're going to hear evidence-based material, not just supposition or fake news. So what happens is basically smoking and COVID-19 is a two-edged sword, and there's 2 edges to it. One is that smokers are less likely than non-smokers to contract COVID. 19 studies from China and 2 from the US have found that the prevalence of smokers among hospitalized COVID, I'm trying to change it, there we go, COVID patients significantly lower than in local populations. The WHO cautions against concluding that smoking is a protective factor. It is not a protective factor at all. And there really isn't basically, a lot of folks that don't smoke don't know this, but there's basically not a lot of difference between smoking cigarettes, pipes, tobacco, vaping, whatever it may be. We're still taking things into our lungs and we're compromising lung function among a number of other things. A lot of young people think that vaping is safer. It actually isn't now. There's been about 8 or 9 years worth of research showing that it is not a protective effect. So what happens is that we're going to try and understand it a little bit, but first of all, we do know we've got one edge here. Now let's go ahead here and let's go back to the second edge. So smokers with COVID are more than 2 times greater likelihood to be more severe. That is basically, they're more likely to be in ICU, ventilated, and or die. So the combination of the two is why we're talking about it being a dangerous mix. And even this includes people who were once smokers and have even stopped for 10 years. Now, while you stop, that's a great thing because you don't get all of the cancers. And in fact, after 5, 10 years, your life expectancy of stopping smoking is the same as a regular smoker. However, what you never do is you never go away from the compromised immune system. And that's why we see people that have stopped for a long time, you know, on oxygen tanks and so forth. So many more have a more severe progression because they've been smokers and now have COVID. So, you know, it's a typical comorbidities, all of them for risk factors, whether you have diabetes and COVID, we've heard about it, high blood pressure and COVID and so forth. Well, smoking and COVID is the same thing. It just has not received much attention. And so you're still at risk with no comorbidities. Okay, so here's kind of what we're talking about. I'm having a little trouble getting, let me see if I can minimize. There we go. Now I'm in good shape. So the risk of using with COVID is basically if you're smoking or vaping, whether it be cannabis or tobacco, and we know in the state of Florida that you can get a medical marijuana prescription. We find lung inflammation, whether it be from either of those two. And we have an immune response in the lungs. So then you add the COVID exposure and the risk of infection is really worse. And we have worse outcomes from the infection. So there's nothing really good about smoking and COVID. Okay, so it damages, what smoking is doing is damaging the lungs' natural defenses against an invasive bacteria and viruses. And then now the serious concern comes from COVID-19 being a virus, having infections involving the respiratory system leading to the cause of death. So we're at the heart of things, unfortunately, with COVID and the lungs and smoking and the lungs. So there are a lot of compounds in cigarettes. When I go and lecture just on smoking alone, there are anywhere from 7,000 to 8,000 substances in cigarettes, all the way from formaldehyde to what you find in batteries and so forth. And it's not something that we normally would go eat or drink or that, but it's in there because when you're trying to cure the tobacco, you need things to, certain chemicals and so forth to put into them. And that's where all of these come to in order to prolong the tobacco product. But that's not good for our lungs. So we also see that smoking is increasing the risk of heart and lung disease. There are lots of comorbidities that increase the susceptibility to a severe case. And again, I just want to point out a severe case of COVID. Okay. There is minimal research on vaping and COVID, but what we do know that vapors are often young people that are severely affected by COVID, and patients are mostly older adults, not younger people. And so we basically see this kind of vaping and COVID or smoking and COVID is kind of a new disease. It really isn't a disease, but the point is that we have compound problems as a result of the two things that are going on. There's much concern based on supposition and generalizations from smoking. We hear all sorts of things in the media. We hear things that don't have a backing. And so people have to be very careful with the facts. But I think if there's one takeaway message here is that if you know somebody that is a smoker, I think, and you're in practice, seeing clients, it is probably important to give them a message. You don't want to scare them. I'm a motivational interviewing trainer, so we would say something like, what do you know about, the effects of smoking cigarettes or vaping on COVID? And most people are going to say they don't know. Well, would you like to learn a little bit more? And so that's where you can have a pamphlet or something and introduce it to them. when we say things like smoking's bad for you, vaping's bad for you, put it together with COVID, it's bad for you, that's not going to get people to think about quitting. We don't like to be told. What we'd like to do is, in motivational interviewing, is be non-judgmental, and we like to have the patient give voice, or your partner give voice, or client, whatever it may be, give voice to what's going on. So it asks them, what do you know about? And they don't. Would you be interested in learning a little bit more? And so that's a way of getting into that without labeling it and not stigmatizing people. It's not very hard to do, but when we have people give voice to the change process, like what will be the best thing if you do reduce your drinking, or what will be the best thing if you do stop smoking, or you can do conversely, what would be the worst thing that would happen if you continue smoking and with the COVID environment. So when we have the patient give voice or the individual give voice, what happens is they hear themselves about 75% of the time more than us lecturing to them. So if you can kind of take that little bit of motivational interviewing skill away when you're talking to a patient or even a partner or something, they're more likely to listen to you. There's an important difference from smoking. Vaping affects the respiratory system, and what we see is that the vaping device, the electronic cigarettes, the e-cigarettes, they administer nicotine without burning the tobacco. And there are these, if you have never seen them, there's these little devices that heat up the fluid containing nicotine and vapor, and then it's inhaled. We're seeing some things that are not good either with just straight vaping. You know, you see on glasses that you buy or plastic, or the bottles for, you know, babies, they say BPA free. Well, what that means is that you're not getting the sloughing off of the plastics. Well, that's not what we want in our lungs. Plastics are not going to be good in our lungs either. So we don't really, these things aren't really controlled by the FDA, unfortunately. So we've got all sorts of things with the vaping, in addition to the fumes, and that it can be sloughing off on the plastics inside of the vaping device. Anyway, the whole point of it is, as you see with these two little lungs there, is that it is not good. There's nothing good about them. It's not going to help anybody get better from COVID, and it's certainly going to have some long-term effects as people do vape a long time. I mean, most of our smokers are 20, 30, 40 years out. So the most popular vaping device, if you aren't into vaping, is something called the Juul, and it's J-U-U-L. This company that owns it is got about 75% of the market. And as I said, most of your e-cigarettes and all of these kinds of new devices, while it was once planned to have the FDA regulate them, politics intervened, as you can imagine, in the Obama administration, and prevented the FDA from looking at them. Whether we come back to this or not is another question, probably not right now. But the warnings, as you see on cigarettes, as you see in this slide here, the warning is the same as you see. It's an addictive chemical no matter what goes on and where you're getting it from. Okay. One of the things that when companies want to make money, they find ways to make money. And these things don't taste the greatest when you're just vaping. So what they learned with e-cigarettes is one way to attract children. Now it's illegal to sell to people under 18, but that doesn't mean that it doesn't go on, is that you flavor it. And there are all sorts of things like bubblegum flavors and whatever else, but fruit, mint flavoring, and it's added to the e-cigarettes. And the manufacturers claim that the flavoring is more satisfying. What we think it does is not that it's just more satisfying, that it's a way to entice adolescents. Now what's happened, fortunately, is that the FDA has banned the flavors, but that hasn't stopped the vaping and the e-cigarettes. So we're still a ways away from preventing further problems from vaping and e-cigarettes. And you see it. I mean, these guys say, the agencies say, no, we're not marketing to kids. They can't buy it. They're too young. But they've got chocolate chip cookie flavors. They've got binky flavors. They've got bubblegum flavors. That one attracted me most of all. So the new kid on the block is this IQOS system, and it was approved just about 3 months ago. And what it does is it uses tobacco, a heating system, THC, to heat up the processed tobacco that releases the nicotine containing the vapor. It doesn't burn the tobacco, as I say, and it's not like when you smoke a cigarette, but it releases it, the vapor. It's not liquid heat either, but what we see is that there are a lot of them out there. Everybody gets into the market. Marlboro Smooth, they're called heat sticks, and on and on and on. The whole point is that these cigarette companies who own these have done a great job of advertising. They've been doing advertising for years. Even when they get restricted and you can't advertise on TV anymore, or you can't advertise within X number of yards of schools and so forth, they still find a way. And that's what it is. It is a business. Okay, so what happens here, what you're looking at, I'm just moving something over here, is that we have inflammation of the lungs, damage to the air sacs where the oxygen exchange is occurring with these e-cigarettes. So you don't see it. And that's one of the reasons that we have trouble convincing young people that this is not good for them. It is probably, if you think of all the addictive behaviors, let's say heroin, cocaine, alcohol, whatever we might want to look at, you don't see this danger in the lungs unless you get an x-ray. So we got young people and others that have been smoking 34 years saying, oh, it's not really a big problem for me. And a lot of times there's not even early evidence of lung damage. Whereas with heroin and cocaine, it's a very risky behavior. It's not something that you can do every day like you do with cigarettes and multiple times vaping. You would see evidence of consequences, negative consequences with heroin and cocaine. And with increased alcohol use, we see that too, but we also see it manifested in drunk driving and so forth. So it's one of those kind of addictive behaviors that people know that it's not good, but they can't see it. So that's why we see so many smokers not stopping until something happens to them in their 50s, 60s, like a spot on their lung, or they can't run as fast if they're a runner. So we have the problem of the electronic cigarettes and vaping associated with injuries, lung injuries, and then COVID, and then we got the same thing going on all over again. Adolescents love these. There's a lot of social pressure. Remember, there's no FDA approval, so it's out there. They hear that it's not a problem at all. The other problem in this day and age with COVID is that they share devices. I don't know how many of you have actually seen kids on the street or wherever they congregate, but they share these devices. It's no more than what's going on with cannabis. People share those devices. They've been doing that for a long time. Well, that's a problem because that's where the respiratory droplets come in and so forth. We found, this is the startling one, that in 2019, the last year that this survey was done, is that more than a quarter, that's 25% of 12th graders vaped in the past month. So we're looking at recency of a behavior. That's as high as it is with alcohol. And now that's compared to with 11% 2 years earlier. So this whole idea of vaping and e-cigarettes has just multiplied. In the last couple of years, it's been multiplying too. If you're worried about that figure, look at this one. Almost 11% of middle school students reported using e-cigarettes. So if you're wondering where they're getting them, I mean, I don't think mom and dad are buying them or aunties buying them, but they're getting them from somewhere. And we know that all of us, when we were in high school, you could go into the bathrooms and get cigarettes and so forth. So it's not surprising that the kids are able to get these kinds of things. So we've got other things going on. I said we've got the biggest thing is the vaping, the e-cigarettes. We've got hookahs, we've got water pipes. Water pipes and hookahs have been around for a long time in Southeast Asia. They are actually allowed up in Portland Oregon, the vaping shops, and that was way before the medical marijuana came in. Well, it's not just medical marijuana in Portland, Oregon. It's actually sold throughout the state legally. So we've got commonly sharing hoses and mouthpieces, sitting close together, no face protection, a secondhand smoke going on, somebody not smoking, but in the circle of friends. So we've got a lot of issues here that really don't mix very well with what's going on with COVID at this point in time. So sitting with others, basically the problem is it opens the gates for infection of one. If somebody's a carrier and you've got 5 or 6 people smoking, it is as bad as probably being close on the beach and other kinds of things. So what's going on with the COVID transmission, as we've probably all heard, so this slide's probably not as useful now as I thought it was when I put this together a couple of months ago, but we've got respiratory droplets. So when the person coughs, sneezes, talks, or aerosol transmission, it comes out. And what happens, there's another thing going on. Being around smokers for a long time during my adolescent life, my parents, they would cough more than, a person that's not smoking. That's because you've got some damage already in the lungs. And so now you've got somebody that's out there smoking and they're not wearing a mask, because you aren't going to wear a mask when smoking or eating, and they cough. And so we've got extra times that people are coughing and extra times that droplets are going into the air. So it's not good to be around a smoker either, I guess, would be the message I would have as a takeaway here. So basically the same kinds of things I'm saying now. As you see in the upper right-hand corner, the smoker is taken or put down the mask as he or she is smoking. Your nose is exposed. So it's not just the person that might have COVID, but it's anybody else in the smoking group that they are easily exposed to the droplets. People touch their mask and part of their face. I mean, we're all worried about our kids going back to school, and these 5 and 6 year olds, do we really think they're going to wear the mask? They're going to take their masks off to eat apples, bananas, whatever they do for lunch, put on the mask again. So we've got all sorts of concerns, and the same concerns are out there with groups of smokers. And I know that many of us are not going to work anymore, so we're not outside of a building or a hospital, but you're any place else. We can't smoke in all 50 states in a public building. So smoking in a department store, a restaurant, whatever, a hospital, a school. So smokers congregate. And even to the extent that we walk in and out of a university building and smokers are outside smoking, it exposes all of us. So I guess I'm sounding fairly negative, but there's nothing good about this for anybody, and particularly for those that are already smoking and have a compromised immune system. It's estimated that smoking a pack of cigarettes a day. Now, a pack of cigarettes is probably pretty standard when you ask folks how long they've been smoking, whether they say 1 year, 5 years, or whatever. It's typically the average is about 1 pack, and that's about 25 cigarettes if you get a cigarette carton here, or its package here in the US. So if you take a look at the 25 cigarettes, what we do know is that a person doesn't just smoke once on a cigarette, they have it put in their mouth several times. And so if you take 30, 25 cigarettes and maybe we look at it about 10 puffs, and that's one of the reasons that a person's addicted, because you've got this pairing up to your mouth, and 10 times just smoking times 30 cigarettes, a lot of pairings, and that's why it's hard to come off of smoking, just because of the association there. There are some things that folks can do. I mean, we all do know, I mean, this is not about smoking, but people to come off of the smoking can use what we call NRTs, nicotine replacements. I'm going to talk a little bit about getting those at the end. They are free in the state of Florida, along with a number of other things. So at least if we've got somebody stopping smoking, perhaps their breathing and that will be better. They're still going to have COPD, a compromised immune system. So what happens is, unfortunately, the idea to stay at home with reduced socializing leads to stress and boredom. And one of the interesting things that people have always said over the years is that the single biggest reason that they smoke or continue smoking has to do with stress and boredom. Now, it is a stimulant by design. The drug is a stimulant, but paradoxically, people say that it reduces them being nervous, it reduces their stress. So psychologically, it's doing that. As a drug compound, it is not a CNS depressant at all. So the other thing that happens is quitting is difficult, and the risk of relapse is extremely high with smokers. It's higher than any addictive behaviors. What we find is about 90% of people relapse within 90 days. A good percentage of them relapse within 30 days. So it's a very relapsing behavior. On average, folks take about 2.5 to 3 times to quit attempts. So it's not easy. Actually, knowing anything about cocaine or heroin, it is harder to get off smoking than it is cocaine and heroin. And again, it's because you're smoking the entire day from the time you roll out of bed to the time you go to bed. And so it's associated with a lot of things. And it's just that you need one, it's going in and out of your system very quickly. And you need one cigarette after another to keep the bolus of nicotine in your system. So what happens is we know that cigarettes are extremely expensive. It used to be, in my day, it was 25 cents a pack. I'm not even sure what they cost now, maybe $5, $7. But that's a lot of after-tax dollars. But one of the things to do is see if you can get the individual to stop smoking, and we can talk about ways that that can be done, because there's no cost to a lot of the treatments that are out there now, fortunately. So some of the effects of the pandemic has been, good effects have been that they prohibited smoking in all sorts of workplaces, whether it be big or small, not just public institutions. There's no incentive at home unless there's strong barriers to stop and you're living with somebody. But we've always seen people go outside to smoke and not smoke in the house around their loved ones and partners. But it's not the same as compared to the workplace where it's banned. Another good thing going on now, we've seen in very recent studies, is that 2/3 of young vapors, and these are young vapors, are now interested in quitting more than before the pandemic. I'm not sure that we really understand it. These were these kind of quick and dirty surveys, but the fact is that they're out there. And those of us that offer smoking cessation programs now have started to advertise for vapors and for e-cigarettes, because when kids see these things that say smoking cessation, stop smoking cigarettes, they don't smoke cigarettes. So it's like advertising for the wrong product. So we now have to appeal to them. And that's what we're doing, as you'll see in our own clinic, and the signs, the advertisements that we've got at the end of this PowerPoint. 50% of people worry about vaping, that it puts them at risk. So people are now learning this is not the best thing to do in life. Okay, so let me see where I'm going. Okay, so what we're looking at here is people worrying about their vaping, and it puts them at risk. This is a study that went out. 57% of the people say that they are worried, and that's a good thing. That's the first step. 52%, half that are vaping, are saying that they want to quit. So we just have to get a message to them. And as I say, any of you that are out there, if you're talking about smoking cigarettes, it's not the message. We've got to talk about vaping and e-cigarettes if we want to get this new population of young people and get them earlier. Because if we can intervene early, like with any kind of illness, whether it be cancer or diabetes, whatever it may be, high blood pressure, if we can intervene earlier, we have a better chance at success. So that's the whole idea in prevention. People are looking for information about how to quit. I basically have not been out and about because I don't want to expose myself or my spouse, but I haven't seen very many things except for coming out of the Florida system where they're talking about quitting smoking. some 45% that say they want to talk to somebody. So that's a good thing. And 30% talk to my parents about vaping. So those of you that are parents and have a youngster smoking or vaping, some of these people are wanting to talk. So it's a surprising kind of thing that they want to do. I think everyone happens to be particularly scared about this coronavirus. Well, not everyone, we know that. I should stop at that point. But we're also, these youngsters are between the ages of 15 and 24 that these results come from. And so as with smoking cigarettes, it was the first thing that happened years ago in the 60s and then into 70s and 80s, is that we finally got the message across that smoking causes cancer and a number of other things. But what started to happen, and it's the same thing with vaping in that, is that secondhand smoke, and we had a group of mothers and a group of other peoples. It's the grassroots movement that caused this kind of thing. Same thing with drunk driving. If we've got grassroots people, they're more likely than anyone else to see things change. So the secondhand smoke increases the risk for COVID. So even if you and I are not smoking, it will increase our risk. The worst thing, and I don't think it's on the slide, is there's something now called third-hand smoke. A lot of people are not aware of it. It's a fairly new thing in the last several years. And third-hand smoke is basically smoke that is getting into, let's say you drive and you've got a car seat there, but your kids, you don't smoke from the kids in the car. You're in your house. You decide to sneak a smoke or so, and it goes into the rugs. It goes into the drapes. Well, you've got kids crawling around on the floor. And so third-hand smoke is exactly the thing that what happens is that the chemicals get embedded into fabrics. And so when my daughter, who's a pediatrician, is talking about to her parents about, do you smoke around your kids? What we hear is, well, no, I don't. I make sure that in the car that they're not there. But think about this, that car seat is a fabric car seat in many, many cases. And so that poor young kid, a baby, and I'm pretty sensitive to kids now. I got a grandson for the first time, 9 months old. I'm very proud. But that baby is sitting there with the head, you know, in the car seat. So secondhand smoke goes there. It increases not only their risk for lung problems because they're smaller. Same thing with pets, by the way. Pets that you love, crawling around on the floor, walking, they're close to the floor. But if you've got secondhand smoke, it increases the risk for a severe COVID. So just thought I would throw that in. It's just not the people vaping and so forth. Indoor group gatherings and people smoke. There's nothing to say you can't smoke at a pool party and so forth. So we've got all sorts of things compounding. And that's why we talk about it as being a double-edged sword or a dangerous mix. I can't think of any other word other than to say it's a dangerous mix. And again, we don't want to scare folks that you're treating or that are friends of yours, that are, family and so forth. But you can carry the droplets or particles containing the virus. So quitting vaping or e-cigarettes is tough. The university, Nova University, has a couple of programs that will allow you to receive free services, and I do mean free services. One of the few things that goes on, the insurance companies aren't paying necessarily for smoking cessation, but what happened is when the lawsuits came down on the cigarette companies, a lot of money went to the states for research and providing free services, and that's what the state of Florida has. State of Florida gives money out to the universities and to other programs, and we are able to provide free group services, free individual services. There are free nicotine patches, free nicotine gum. The services are available in English and Spanish. And the ones that we're running over at Nova at the Psychological Services Center, you don't enter into a mental health service, you don't enter into a clinic. And the reason is because we can view these problems not as like depression or anxiety. We look at them as psychoeducational, helping somebody get off of nicotine. Now, if somebody is depressed and smoking and that, they might need, you know, some psychological services. But these are basically free services where you can come in just individually and be seen, get nicotine patches and so forth, or you can go into groups, or you can call the quit line and get free nicotine patches. You don't even have to come in to a clinic to get them. So there's a lot to learn. Just type in, you know, smoking, vaping, state of Florida, and they'll also show you. Some of you don't live in the state of Florida, but all these things are available in most states for free. The counties all have in Florida different programs, so you don't have to travel to a Dade, Miami-Dade or Broward. You can be up in almost any of the counties to get these. If you have any problems, give this phone number a call, and we can direct you to a state where it's convenient. We can direct you to a county where it's convenient, or more importantly, why I have these up is we can provide you free services in Spanish and English, as well as putting you in the direction for nicotine patches. So there it is again, quit vaping. Those are the kinds of things that we're now putting up on our marquees at Nova. We're using in our advertisements because they attract young people, as I said earlier, versus these. This is a message that is a disconnect because these kids aren't smoking. But it took us a long time to kind of learn that. So again, whether it's smoking cigarettes or vaping or e-cigarettes, same phone number, 954-262-5860. You can just leave a first name and your phone number or an email, and we can get back to you. And we usually get back within 24 to 48 hours and can see you in a short period of time. Also, very importantly, we would prefer to do this via telehealth. We do know that telehealth therapy kinds of things, in most cases, and I say in most cases, is not going to be any less successful than if you came in. So we can do these by Zoom individually. We can do them by Zoom in groups. Sessions last in groups about 90 minutes. For individual, we can do, 60 minutes. We can do it about any time up until about 8 o'clock at night. So we can be there for you if you're working or daycare or something else. And so the last thing that I want to offer up to you really isn't necessarily around smoking, but it is around smoking and COVID and everything else. We're all getting stressed. This is now 6-7 months in. No one thought that we would be, social distancing. Socializing obviously is more important than any of us ever thought. It's difficult. We have friends, colleagues, grandparents, parents that have come down with the virus. We've had them also pass. We're over 200,000 people in this country. And so what's happening is that all of us are feeling some level of stress by COVID. And about 3 or 4 months ago, we were talking about maybe it might be helpful to have social support groups for people that are stressed by COVID. And we've been doing that now, and we've got more and more people that are doing that. These are free. It's not like you start and you do 6 sessions or 5 sessions. You can come and go as the need is evident. And what we found is that people are sharing. It's helpful to share. The social support we know in psychology is one of the things that helps people get by things. So besides the smoking, I thought I would throw this in. This number is a different phone number. It's the number for the stress by COVID groups. And again, call that, leave a message, and we'll get back to you. So I was going to quit at around 12:40. There's no reason why we can't quit now and take questions. But again, welcome your coming and looking for services. If you just want to ask questions, call those numbers. We'll get back to you. And please stay safe. I wish you all the best, and hopefully this will be over sooner than later. Thank you.
Thank you so much, Dr. Sobell. Thank you so much for sharing this amazing information. I learned a lot actually listening to you. And we do have lots of questions. Really, one of the first question is your PowerPoint. Will it be available for our participants?
Yes, for sure.
Okay, wonderful. And so,
Greg, I'll get it to you, and then you can send it out as you see fit, okay?
Thank you, thank you. So a few questions deal with some of the particular instruments that you were talking about. For instance, one question was, what is the purpose of the heat stick?
It burns the tobacco in a different way. It heats it up rather than, sorry, let me try. It doesn't, when you smoke a cigarette, it's burning the actual tobacco and you're getting the fumes and that there. What this does is supposedly the idea was that it would be safer. And so it is just taking it and heating it. You're still inhaling it the same way. One of the things that we do know, one of the fastest ways to get a drug into your system, this is not something to go out there and do, but if you inhale, it's going to get into your system 15 to 20 seconds. And that's one of the reasons that smokers continue to smoke, because it goes out quickly too.
So are smokers more likely to get COVID?
One might presume that because they've got a compromised immune system, but we really don't know. There's no randomized clinical trials, evidence-based trials are out there yet. I mean, we're looking for the vaccine first, but I would suspect that it's not going to be helpful to you. That I would say. So I'm going to tell you something that I don't know or that we don't know.
So if someone has COVID and blowing out the smoke from their vape, does that allow the virus to go faster to infect individuals around them?
Don't know. There's this whole thing about smoking and vaping is kind of new. I've heard talk about it, but it's come on in maybe the last couple of months. Don't know at all. Don't know.
Okay. And what would you suggest would be the most effective approaches to have the conversations with teenagers?
Well, what I would ask them is, what do they know about, just say, look, I've been listening to a lot of things related to folks that have COVID. If they have I'm trying to think of what we call a gate door opener. If they have a relative, let's say, that has diabetes or blood pressure or something, you can say, you know, I'm kind of worried about grandma, you know, she has diabetes and has got the COVID and these combinations of kinds of illnesses. It's not good, they say. And now I heard the other day that people that are smoking, or I guess vaping too, you can kind of pretend that you don't know a whole lot. Also, it's dangerous. It's a dangerous mix because you've got compromised immune system with smoking that you might not see right away, even if you're young. And then the same thing is going on with the COVID. And I'm wondering what you know about that. Anything at all? And so you ask them, and that's not actually blaming them. I mean, if you can go kind of a distal thing by talking about grandma or somebody else that's got a comorbid conditions, because that's what we're talking about. We're talking about compromised immune system with the smoking and a compromised immune system with COVID. So if you can kind of do that, but then you can say, like we do in motivational interviewing, is, you know, would you like to learn a little bit more? And so the big thing, take home message, I've been doing motivational interviewing for years. It's a set of communication skills that allows you to better connect with somebody to change a risky behavior. So we don't say alcohol abuser. We talk about people that smoke. We talk about the good things about vaping, the less good things. So try to stay away from being judgmental, especially with a youngster, because everybody is judging them and telling them what to do. So if you can go kind of a backdoor approach. We've got some things online that I can have Greg send you out that you can look at motivational interviewing and how to approach these kinds of conversations too. So maybe you can send that link out, because everything is free along with smoking stuff when he sends out the slides.
And so walk us through the process. You listed several telephone numbers. So if we had someone who would like to start the process to stop smoking, what happens?
So they would call that number, the 954-262-5860 number. It's dedicated to smoking, vaping, and that. You're probably not going to get somebody there because we're not at the university for the most part right now, because it's as dangerous as any place else. But we look in on that phone number every 3-4 hours. And then somebody, unless it's like 11 o'clock at night or 12 o'clock at night, somebody will call you back immediately. Now, if you don't want to leave, why you called, just say, could you call back and only ask for Gregory, or whatever. So you can leave just a simple name. If you don't want us to call you back, we can also give you a website that you can go to. So that would be the first contact. Then we're going to call you back and we're going to say hello and what are some of your concerns around nicotine products, because we don't know why they're calling you. And at that point, they probably are going to ask us. We can arrange to get them in. We don't have to do any intensive screening because it's not a clinic. It's a psychoeducational program. We can get them in the next day. We can get them in a week from now. We can get them in at 4 in the afternoon, 7:30. If they want a group, fine. We've got 2 Spanish speakers. We can also send out some material if they have something. We do that with PDFs and so forth. If they're just kind of trying to feel out the landscape, we're not going to, force them into anything. If they want us to call them back, we can do that. We will try 3 times and leave a message if they want us to. After 3 times, you kind of get the sense that maybe somebody's not ready. But if you don't want to come do a Zoom meeting, and all you want are the NRTs, you can say that, and we can tell you how to get them if you're in Florida, and again, free. And you can get them 2 or 3 times too. And they're kind of expensive. If you buy them at Costco, they're about $35. So you can probably save yourself $100 for a couple months supplies or whatever it is.
We have a question. What do you know about the response? What has sort of, based on the fact that we're in a pandemic, are you getting more individuals requesting your services?
Yes, for certain things. But one of the things, you're saying services around smoking, yes, but this is not unusual because what's also going on is people are depressed. The American Psychological Association, I'm a member, has done several surveys every year for the last 2 or 3 years, and now they've picked up on this. We have higher numbers of people that are depressed than ever before. And think about it. I can't go see my grandson. I was out there you can see the smile. I love him. I can't go out there. I came back, I was there for 5 months, but am I depressed? Not really depressed, but I would like to go out to dinner, would like to do a couple of other things with friends, but I'm over 65. My husband, Mark, has got a slight medical problem. I'm not putting anybody at risk, including my grandson. So depression is out there. People have lost their jobs, their house may be on the line, and we can go on and on and on with that. So it's not surprised to see that happening. So if somebody feels like, oh my God, I'm smoking more, or I'm depressed and smoking, it's normal. It's what's happening. One other thing, just to kind of throw it out there, people are anxious. The other thing that we're seeing is that the sales of alcohol are 100% greater than they were in January. Now that doesn't mean this person has an alcohol use problem, but we're drinking a bit more. And so it's affecting a lot of us in lots and lots of ways. It's not easy.
Now, the services that you provide, are these services only for Florida residents?
Oh, I'm glad you brought that up. No, it was one of the things I was supposed to put on the last slide. Thank you. No, they're not, because we're doing Zoom and because we're not taking any real information on you, and you're not a patient and you're not in a clinic. You can get services if you live in Alaska or in the time zone. We'll have to work out. But no, the services are totally free and available to anybody from age 13 on, and yeah, any place.
Okay. We had a question concerning your proactive approach in the conversation, your motivational language. So do you believe there will be an increase in COVID-19, sort of increase in services, individuals who are vaping or smoking, I guess in the post-COVID-19 world?
Well, that's going to be an interesting question. I thought you were going to stop and say.
I think I put 2 questions together. I apologize. I was looking at their response.
Answer both of them. What I would be concerned about is that, I'm thinking The first time that we hear it's really gone, really gone, I would like to drink the half a bottle of champagne. But maybe a quarter of a bottle. But the thing is, I think we're going to have, I'm guessing, because what science is all about, and I'm a clinical scientist, is evaluating and finding out what's going to happen. But I think there is, on initial basis, people are going to celebrate.
Mm-hmm.
We're going to go out. Whether that increases it or not and comes back, I don't know. But I wouldn't be surprised if people go back to some form of tobacco use. And I'll just tell you what it's based on. We see women who are pregnant, and there's a motivator to stop smoking, and without any treatment or anything. That motivator is that little kid inside of you. And that kid is and like what we call an affective hook. And you're going to say, well, I don't want to damage my child, because smoking's going into the kid too, you know, at even greater rates, because that little kid is smaller than you. So where I'm going with this is that they stop. Moms stop. The unfortunate part of this is that a good percentage of the moms then go back to smoking. I would say about 25%. And the real problem there, of course, and that's why my daughter is a pediatrician, we're working with the parents that way. We're saying, hey, what do you know about second and third hand smoke? Mm-hmm. So, you know, my hope is that it's a small percentage that go back, or that if people found that it's better, runners, whatever, but we don't know. But it's a good thing to think about, and maybe do some counseling around. We call that relapse prevention.
Going back to your motivational approach, so how do you motivate someone who is resistant to either the information or to even consider, you know, coming in for a conversation?
Well, what happened is, in the early days, the reason that motivational interviewing got started is that those of us in the addictions field were finding people that were, quote, not motivated, quote, resistant. Well, there's no such thing. It's the thing is, the person is not ready, or they're not ambivalent. The language, I love MI. I've been doing this so much, but the language is important. So if I say you have to stop smoking, it's bad for you. We hear practitioners doing that all the time. So what we would do is to say, if we've got a person in front of us, or we've got motivational materials, are going to have the same non-judgmental. Are you interested in changing your alcohol use? That's very different. Uh-huh. How we normally do it. So what we would do is to say to the person that comes in, and you know, I saw that your mom kind of pushed you into this, you say, and she doesn't like you vaping, and she noticed that you, you know, got some cannabis in your drawer. Sounds like you're not very, so what you do is you reflect whatever they're saying. It sounds like you're not very happy that she found it and went through your drawers. I don't blame you. Most people won't, and we're normalizing it. So let me get your take on it. What are some of the good things of vaping? Now, some of you out there are thinking that I need to have my head examined and almost ready to turn off the camera, but don't, because what I'm going to say to you very quickly is that there's no behavior that doesn't have some good things, maybe on a short-term basis, and some less good things. Now, even the language, less good things. But here's what happens. So you ask the kid, the adolescent, whoever it is, so what are some of the good things? And then they'll say to you, and then what else and what else? So you've got the half of the equation. There are some good things. And when you fail to recognize good things, you're not validating them. When you're talking to an adolescent about using cannabis or cocaine or anything, and you say, tell me the good things, they look at you first as if you need your head examined. And then I say, no, I'm not kidding. Really, there's some good things. They tell you. I've not had anybody not. Now, I've been doing MI for a long time, so I've got the skill set down. But then I'll say, okay, so, you know, Robert, so there's some good things, and your mom doesn't seem to appreciate them. I'm reflecting. But on the other hand, I'm wondering, are there less good things? And what happens is you have a safe thing. We've gone from good and validating to less good things. And what it does is it validates for them. It allows them to trust you as an older adult or older, whatever, student, intern. And then you can say, okay, so Robert, there's some very good things on a short-term basis. And now I'm hearing that mom's gotten on your back, and they're, you know, doing whatever they're doing, and putting curfews on you. So where does that leave you? And then you can do things, I'm doing my short version of so where does that leave you? What would be the best thing that could happen to you if you did stop vaping? And now let's look at the flip thing. What would be the less good? Now, if you guys go on the website, there's a whole thing on motivational interviewing that gives you little snippets of how to do each of those. And it's just about a 7 or 8 page colored document on motivational interviewing. And if you can't find it, you've got my email, and I'll be glad to help any of you out.
And that was wonderful. In fact, the next question is there a consensus concerning effective replacement behaviors or behavior functions for smoking?
The nicotine patch is the best one. We have people, if people remember the old days with methadone, we got people off of heroin by being on methadone. And for a while, there was a lot of, oh my God, this person's going to be addicted to methadone. But what happens is we can give a dose that is kind of, I can't think of the word, maybe protective or less risky, but it won't get you addicted. And we have these folks going back for 30, 40 years now that are on methadone. I'm going to answer your question on the nicotine, but being citizens, productive, no arrests, no stealing. So there is a comparable consideration. Actually, there's several of them, but the first one that's the easiest, does not require a prescription anymore, is the nicotine replacement patch. You can also have gum. People don't, sometimes the patch will taper down. There's various milligrams of it, but you can have gum. So you could anticipate, oh, it's going to be difficult going in to see my boss or whomever. And the gum takes about 15 minutes to take effect. And you can also park it and use it. There's also medication for prescriptions and things like that. I think for the vaping, I'm going to just say, I haven't really been asked this question, but I think for the vaping and the e-cigarettes, the NRTs are probably going to be your best bet because it has the nicotine in it and you are becoming addicted to that particular drug. The nicotine is the drug. And you want to say to me, well, oh my God, I could get cancer from nicotine. No. The 7,000 to 8,000 chemicals will give it to you, like formaldehyde and all of those things, not the nicotine. So you can be on the nicotine patch, and people have been, or the gum for now 15 years, or double doses of NRTs, and not had cancer. The cancer comes from those chemicals on the tobacco product from curing.
Could you remind us again the age group for the services?
13 to whatever.
So, and again, the parent would actually make the phone call in order to have the conversation?
Well, they don't have to because it's not psychotherapy. And so we have young people do call in and ask. Now, you know, if somebody's 12 and that, I'm sure the parent can call in. We can do the services. There's just some special other things that we have to consider too. But no, you don't need parental consent for that. There are a number of things in the state of Florida and other states that you don't need for psychoeducational.
So we do have a question concerning the availability of a similar service in the Metro DC area. Are you aware of any other service?
We will find it for you. You can send us an email. They're all over, not on the top of my hat, but send us and we can probably find it easier for you because we can hook into the main place where services are operated.
Could you talk about the support group that you have in Spanish?
The COVID one?
Yes.
Well, it was one of my ideas, sitting watching support groups on something. And then I was thinking about the stress of talking to a couple of friends, and they're feeling a little bit more than me. I'm still working. I think I like what I'm still doing at Nova. And then I got my grandson, which is the big plus. And they were talking about being so stressful, and if we could just have somebody to talk to, because there were 3 or 4 of us talking. And that's where I went to bed that night and said, hey, we could provide COVID stress groups. And that started, the idea kind of started at the 1st of August, end of July, something like that. So just one of those nice things that happened.
Now, could you talk about some of the other services that your clinic provides?
Well, we provide insomnia. People have trouble sleeping, obviously, too. We have insomnia programs, which are evidence-based. People that want to reduce their drinking. We don't have services for real severe drug and alcohol abusers, but people that might be doing bingy cocaine kinds of things, people that might be drinking, women that might be drinking more than 4 drinks, 3 or 4 drinks a day. That's high risk, not diagnosable. Males that are drinking more than 14 a week, again, not diagnosable, but it's going to get to the point where you might need more and more with tolerance. There's no reason that you can't reduce. At that point, we're looking at, hey, what are the stressors? Well, COVID's a stressor. I lost my job. What my kids are on my nerves. I can't get them back. What's going on? So a whole kind of a range of services around substances, procrastination, any other kinds of addictions like porn, things like that. But let me do a big plug for NOVA just generally, and then we can stop. NOVA has about 14 faculty clinics, really great clinics that are on a sliding fee basis, anywhere from $8 to whatever, but we don't take Medicaid, Medicare, insurance. But from trauma to child problems to things like neuropsychological evaluations, anxiety, things like that. So there's special clinics. And again, probably easier for me to just send out those links, or Gregory can send them out to the Psychological Services Clinic. And we can do the initial service we have to do in place in a clinic for about 10, 20 minutes to get the confidentiality stuff. But then we can do telehealth in the state of Florida.
So we are seeing some other questions concerning contact information or contact telephone number, which we will share with everyone at after this session. A couple final questions. Talk about the vaping flavors without nicotine. Again, obviously addicting. And what else can you tell us about that?
Well, let's think about what goes on when we go to buy something. If you go to buy cereal, we know that in the younger days, people like the sugary cereals. So the flavor makes a big difference. Remember, George W. Bush didn't like broccoli? Well, that doesn't have the greatest flavor. Maybe put a lot of butter and salt. But the point is, these are big business companies, guys. They're not like just you and I. They're trying to make money. So if they could have put dirt into it and it tasted good, I'm sure they might have. Now that's a bit of a joke, but the point is bubble gum. We chew bubble gum. Chocolate chip cookies and chocolate dough or cookie dough and so forth. So they're out there to make money, but they're clearly putting in a flavor with sugar in it or a sweetener in it that will be attractive to kids. Now, unfortunately, they took that out, they banned that, and these kids are still smoking. So I guess where there's a will, there's a way.
So could you also briefly, I have just 2 final questions, your other role at the university?
My other role, I got a lot of those roles. You mean
in the clinical psychology program?
Oh yeah, I have a really fun job, but most of the time, but I'm Associate Director of Clinical Training. Is that the one you're meaning?
Mm-hmm.
And what I get to do, I have the good fortune of being able to assign students to practica sites. We have about 85 great sites throughout Broward-Dade, Palm County, and Miami-Dade, Broward, and it's really fun because I get to mentor people and help them decide their careers and where to go and so forth. But it's a big job, and anybody wanting to do it will glad to share that with you. I'm up 24/7 sometimes doing this, but I really like it. I like what I do.
And one final question. What would you like to leave the audience? What information would you like to leave us with concerning this very important topic?
I think I knew somebody was going to ask that. I think we have to be patient. Be patient not only with ourselves and that this thing could go on longer, and we have to adapt. We have adapted over the centuries, and we've adapted to a lot of financial difficulties in 2008, the Great Depression and so forth, and we came out of it better. If you look at what Franklin D. Roosevelt did, hopefully we'll adapt. But I think you got to keep more of that positive set, go find something new to do, hobbies, whatever, read books. But if we get ourselves down, then I think we're getting ourselves into problems that none of us need to have. So be patient, go No, you don't want to kiss a loved one unless you've been living with that loved one for 5 months and you're safe. But just be
Virtual.
patient and stay safe.
Yes, thank you so much. So thank you so much for sharing this really informative and really important information on this topic. Two final things for our audience. Again, the session was recorded and will be available next week at nova.edu/Shark Chats. We will have another session on Wednesday, September the 30th at noon. It is called Racism and COVID-19, Supporting Asian American Youth Throughout the School Year. So with that said, thank you so much for participating, and be well.